Thanks everyone for returning for our fourth and final session of today's York Circle at Home lecture series. For those joining the webinar now, welcome. It's a pleasure to have you join us for this online lecture. My name is Julie Lafford. I'm the Executive Director for Alumni Engagement at York University. Before we begin today, I want to thank the event team who's been really hard at work behind the scenes today, making this such a success. Ben, Christina, Melanie, thank you so much. You've done an amazing job. For those of you who have attended other sessions today, I realize you may already have heard what I'm about to say at least once before. So thanks for bearing with me. I'm going to go through it one more time for newcomers to this session. The world has drastically changed since the last time we met on campus for York Circle in February. And I'm happy to be able to bring this lecture series to you in a virtual format during the pandemic. As many of you know, York Circle is an opportunity to learn from some of the incredible faculty and researchers here at York. And we'll continue that today, as you'll hear from some of the university's leading scholars, many of whom pivoted their own research to study the varying effects of this pandemic and draw from their own expertise to speak to you today about some of its lasting impacts and how to navigate these changes. Even though we can't gather physically, we will continue to offer you programming and events virtually so we can stay connected and you can stay informed during this challenging time. Before we begin, I'd like to provide an update on some of the ways York is responding to the pandemic to support our students and our community. First of all, we've launched the COVID-19 Student Relief Fund. This is to help York students cover unexpected housing, rent, food, travel, and other costs due to the pandemic. York has also issued a call for time-sensitive special research proposals with a COVID-19 focus. We have $250,000 in funding that will be committed towards that. Finally, but not least, researchers and staff at York have come together to respond to the call for supplies to help Canada and Ontario combat COVID-19. So far, York has donated over 60,000 medical supplies from the faculties of Science, Health, and the School of Arts, Media, Performance, and Design. And though we aren't on campus today, I'd still like to acknowledge that many Indigenous nations have long-standing relationships with the territories upon which York University campuses are located that precede the establishment of the university. York acknowledges its presence on the traditional territory of many Indigenous nations. This territory is subject to the Dish with One Spoon Wampum Belt Covenant, an agreement to peaceably share and care for the Great Lakes region. Before we begin, I do have a poll, second to last poll of the day for all of you inquiring, have you ever attended a York Circle lecture before this? Please take a moment to respond to that. It should be popping up on your screen at any moment. I see we have about 60 participants in the webinar right now. I'm sure there'll be more joining soon. And we also have many joining on Facebook as well. Thank you for being here. It's wonderful to have so many of you with us on this Saturday afternoon. I have the results of that poll now. And we have 93% of you have attended a York Circle lecture. Thank you for coming back. And we have 3 newcomers. Thank you for joining us. Glad you can be here. Newcomers and everyone, in fact, if you do have any trouble with the webinar functionality or questions about the content, please don't be shy to use that Q&A button at the bottom of your screen. Our team is here to help you. So without further ado, I'm really pleased to welcome Dr. Aaida Mamuji, Assistant Professor of Disaster and Emergency Management, Dr. Jack Rozdilsky, Associate Professor of Disaster and Emergency Management, and Terri Chu, Ph.D. candidate, Communication and Culture today. Welcome. I'm so glad that the three of you can be with us. Their discussion today will look at how Chinese communities in the Greater Toronto Area are facing impacts to their personal well-being and livelihoods by way of discrimination and anti-Chinese sentiment due to the COVID-19 pandemic. Through their work, these researchers are seeking to better understand the social impact and coping capacity of Chinese diaspora communities in large urban centers globally, mainly in Toronto and Nairobi, They've been conducting in-depth interviews with members of the Chinese diaspora communities in the GTA during the months of March and April 2020. Welcome. Really looking forward to your lecture today, and I'll hand things over to you now.
Well, thank you so much for having us. I'm just going to share my screen right now. And we're going to start off with Professor Jack Rozdilsky.
Yes, to York University, thank you for hosting us this afternoon. And on behalf of myself, Dr. Mamuji, Principal Investigator, and Ms. Chu, who is also a co-investigator on the project, I would like to welcome you to this afternoon's presentation. Our presentation is titled, Understanding Lived Experiences During COVID-19, Chinese Diaspora Communities in the GTA. Next slide. The content of our presentation will have 4 parts. I'm going to begin by providing a research overview and also providing some commentary on the Greater Toronto Area's Chinese community and impacts of COVID-19. Second, Ms. Chu is going to follow up, addressing some issues related to stigma as related to COVID-19. And to close, Dr. Mamuji is going to present us with some important information concerning some of the things that we have learned up to this point in our research project. And then I believe we will be taking some questions and answers. Next slide. First of all, on behalf of the research team, we would all like to acknowledge that many people are suffering both health-wise and economically in our community. We'd especially like to extend condolences to those who have suffered losses. The most recent data indicates to us that in Canada, we are now at over 3,000 deaths. Right now in Ontario, we lie at about 16,000 cases and about over 1,100 deaths as of this morning, with today's data indicating to us that we have 511 new cases in Ontario overnight, and unfortunately 55 more deaths in Ontario since yesterday. So again, we are in the middle of a very significant and ongoing threat to residents of the Greater Toronto Area. Next slide. Our research is funded through the Canadian government by the Canadian Institutes of Health Research, and our research has 2 different sides to it, where we are investigating the same types of questions, but focusing on 2 different localities. Our remarks today primarily relate to our findings here in the Greater Toronto Area, but we also have a parallel team working in Nairobi, Kenya, where our group in Africa of cooperating researchers is also looking at some of the same types of questions. And in the end, we hope to be able to compare and contrast some of the findings between what's taking place here in North America and how the African continent is being impacted by social factors related to COVID-19. Next slide. Now, in terms of understanding Canada's Chinese community, we acknowledge that when we say the word Chinese community, that we are implying a wide diaspora of persons, including persons in China, Hong Kong, Taiwan, and some other places. Nationally, Chinese Canadians make up one of the largest ethnic group in the country, with over 1.8 million people of Chinese origin in Canada. And when we look at immigration patterns, new immigrants have settled particularly in Vancouver and Toronto. And what we find with the immigration experience, that the immigration experience varies widely, depending on the decade of when the new immigrants have arrived, their socioeconomic status, and other factors. Next slide. In terms of understanding the Greater Toronto Area's Chinese community, as we know, there are several Chinese and Asian ethnic enclaves within the communities which we are in. Specifically for Toronto City itself, we are well aware of the Chinatown on Spadina Avenue, as well as concentrations of Chinese populations in Scarborough and North York. In addition, in the city of Toronto's surrounding suburbs and cities, Markham, Mississauga, and Richmond Hill are areas of the Greater Toronto area where we have significant Chinese populations. In fact, Markham's population is 46% ethnically Chinese. Next slide. One of the things we are investigating in our research are the impacts of COVID-19 on the Chinese community. We note that the Chinese community is not different from anyone else, as everyone right now is being impacted by the societal interruptions due to COVID-19, including what we're experiencing in today's lecture, doing this remotely. But social isolation, loss of income, shift of work to home, struggles to keep healthy, etc., are things that everyone is facing. We are also finding within the Chinese community increased stresses due to losses of family and friends who have experienced COVID-19 in Asia. Unfortunately, we have also been finding that there have been misplaced fears directed towards specific businesses, leading to loss of customers as one of the impacts, where we have seen an emergence of discrimination towards people and places, which is being falsely conflated with what some are calling the Wuhan flu. Now, this type of discrimination is not necessarily something that is new and has been around in the past in different formats, but one of the things our research is investigating is just our forms of discrimination, forms of stigma, and better trying to understand how the varying communities in the Greater Toronto area are socially coping with impacts of COVID-19. Next slide. And now I'd like to turn over the presentation to Ms. Chu, who will be addressing some issues related to stigma. Ms. Chu, please.
Thank you. So in the early days of COVID, when we first started hearing about it, the Chinese community had basically braced itself for a repeat of SARS. And you see a lot of Chinese politicians and a lot of people like myself. We actually did a huge media blitz towards the end of January to try to say, hey, don't be afraid, stop the stigma. There's no need to have any racism towards the community. And the community right away started dealing with things like petitions against the community in things like mandatory quarantines, flight bans from China. There were calls for that almost right away. As long as I live, I probably do not want to hear the term wet market ever again. A wet market is simply a market where you buy food, as opposed to a dry market, which is a place where you buy clothing and jewelry and you know, that kind of stuff. And the number of endless op-eds about how the wet markets need to come to an end and be abolished was just phenomenal. And these are people that have no idea what a wet market is. It's like saying, you know what, grocery stores should not exist. So that level of ignorance and bigotry, it really hit home for many in the community. The women you see on your screen, the lower right-hand side, this photo, you probably saw it on your social media. It went viral basically overnight. Her name is Wang Mingyoung. And this video, it was part of a video blog series that she had done. She's a Chinese influencer, whatever that is. And she does a lot of travel blogging or vlogging. And this photo went viral basically overnight as proof that the Chinese are gross. They eat bats. This is their fault that this pandemic is happening. The only problem is this video wasn't even shot in China. It was, the young woman actually had to go abroad to Micronesia to get an experience as exotic as eating bats. So the facts though didn't actually stop any of the racism or the memes to keep on going. Next slide. So there was definitely a lot of fear that the community faced, and that fear did not necessarily match the reality. So you see here, there was this petition to suspend all flights from China into Canada. It was signed by 113,000 people. And if you look at the data, this was published in the National Post just a few days ago. There were actually very few cases that were imported from China. In fact, it didn't even make this top list. And when I looked, I think it was about 4. I could be wrong though. And most of the cases came from the US, the UK. When Iran had their explosion in COVID cases, there was a petition also to stop flights between Canada and Iran. That got all of 19 signatures before the petition closed. And as far as I could tell, there were no petitions to stop flights from Italy or Portugal, or Spain rather, despite the massive outbreak centers that were in those regions. Next slide. So thankfully, in Toronto, we are fairly multicultural of a place. Most of the interactions I would classify as microaggressions. And these are some of the things that we heard back. You know, there was a child that was bullied. People said, oh, your dad has coronavirus. And when the mother confronted the teacher said, oh, you know what, that's just playground talk. Someone else was told, you know, you shouldn't wear a mask because you're Asian. And this was very interesting. A lot of people had said to us, nobody took our concerns seriously. There was a section of the Chinese diaspora that was trying to raise the alarm quite early on, saying, hey, this is more serious than what we're taking it to be. Like, we are well in tune with the news back home. We know what's going on. We should take this much more seriously. And they felt they were screaming into the wind, that no one was really listening to them. And we had one research participant that was interesting. She, at the very beginning, she says, you know, like, I'm quite afraid of the disease. And then as time wore on, and I think a lot of that had to do with the microaggression, she's like, I became more afraid to go out, not because of catching the disease, but because of encountering somebody who was racist. But thankfully, again, we haven't had, as far as our research anyways, many incidences of actual violence. And we have heard that in other regions, thankfully not here. Next slide. I do want to talk a little bit about how complex the issue is, though. Is it really xenophobia or is it fear? And many actually Chinese people were behind some of these petitions. Did they realize they were fueling the stigma? Probably not. Most diaspora communities are actually very anti-CCP, the Chinese Communist Party, and that's part of the reason they're here, frankly. A lot of the communities from Hong Kong, Taiwan, they have a very complicated relationship with China. If anybody knows anything about Chinese history, China has a lot of political issues, for lack of a better way to put it. So there are lots of these populations that are in fact very anti-Chinese government, and they want China to wear this failure. They had no problem with the term Chinese virus, and that added to a lot of the stigma that fueled a lot of the racism that was happening. And you see Donald Trump had no problems tweeting out that this was a Chinese virus. Aaron O'Toole, he's running for the leadership of the Conservative Party. He put out this graphic and actually was part of his fundraising drive. It did not help the Chinese community at all. And this very complicated history between the various groups of the Chinese diaspora being as fractured as it is did not help, because we weren't able to put up any kind of a united front against this kind of racism. Next slide. So we definitely want to thank our allies, especially the ones early on who had put themselves out there, like Mayor Frank Scarpetti was at the Wuhan Noodle restaurant February 4th. But I'm not sure how much of this has actually backfired on the community since. There's a bit of a "we told you so" moment when everybody says, look, a lot of these businesses, over 90% of their clientele is Chinese, and it's the Chinese who were actually practicing social distancing from the beginning. This wasn't stigma. You guys are crying wolf. There's no racism. And so we don't know how helpful or hurtful a lot of these actions were, but we do want to thank them for those attempts, especially early in the early days. And separately, there are many campaigns that are happening, like Stop the Spread, I'm Not a Virus. Many people are working very diligently to try and stop that stigma in this community, and there's a lot of effort going on. So, Aaida?
Great, wonderful. Thank you so much, Jack and Terry. So what I'm going to talk about now is about the importance of actually learning from the community. And this is something that we've been able to do really well through our engagement with members of Chinese communities in the GTA with our interviews. But I think it's really important to recap the timeline because it kind of helps put things into perspective. So November 17th, if you can think as far back as then, that was when the first reported COVID-19 case occurred in China. And initially it wasn't known what it was, but there were whistleblower reports of a SARS-like illness by a doctor in China in early December. And then in January 23rd, that's when the central government of China imposes a lockdown in Wuhan and in other cities in Hubei. And then January 25th is Chinese New Year. And it just so happened that January 25th was also the time that the first reported case in Canada. And to put things also into perspective, we started our social distancing measures in mid-March. Ontario declared its state of emergency on March 17th. So there's quite some time that elapsed. But something that's really interesting that we've been able to find out, and Terri has already alluded to this, is that there are many early actions that members of Chinese communities took very early on, as early as the beginning of January. I do want to preface this, what I'm going to say though, by mentioning the fact that like any community, Chinese diaspora communities are diverse, and it's not like every single Chinese person did what I'm going to be talking about, but there were groups of people, especially those that are tightly linked to family and friends in mainland China or Hong Kong or Taiwan, that you saw take early actions, which I'll talk about right now. So one of the first things that we noticed, and this is a practice that you see very often in Asia, is that here in Canada, you had a lot of people starting to wear masks as early as January. And in particular, for those families that are connected with people in Asia, they were being told about this situation in Wuhan and what was, how things were changing, and they were being urged by their family and friends to wear masks and to adopt public health measures. And in fact, we have some participants say that their family members actually sent them masks from China. And then you also had, parents in the GTA sending their children to school with masks on as early as January. And it's really interesting to note because today we now see a shift in the way public officials in Canada are addressing the mask issue. And at that time when the members of the Chinese community were were wearing masks, they were unfortunately subject to stigmas, as Terri mentioned. We also see a lot of physical distancing that was taken on by the Chinese community. In fact, recall I mentioned that January 25th was the first day of Chinese New Year. And we saw that a lot of the celebrations that were set for Chinese New Year in Chinatown were directly impacted. So patrons didn't show up, performers didn't show up. And it's important to note that they didn't come because they were they understood that this was now a serious case. We had the first case in Canada now, and we need to take these measures when we need to physically distance, which now we know in terms of the broader community is a measure that is really important, but the community was already a step ahead. We had some parents decide to keep their kids at home long before Ontario's state of emergency and schools were closed here because they didn't want to, they wanted to avoid exposure, and because some of them have relayed that they had elderly people living in the same household and they didn't want to put them at risk. We have many cases where individuals that had traveled to China over the Christmas break self-isolated on their return. So without having been told, we didn't really have those measures in place at that time, but they knew the risks and so decided to self-isolate. And we also had companies, especially one case where predominantly the staff is, it's a Chinese company, and they asked their employees to work from home as early as February. And I know for most of us who are continuing to work, we're now working from home. We also saw a lot of petitions to officials. And so, you know, as at the end of January, we saw petitions that were, many of them started by members of the Chinese community to the House of Commons, to the Prime Minister, to the Minister of Health, Minister of Transport, all requesting certain measures to be taken, including the suspension of all flights from China into Canada, increased coronavirus quarantine screening measures. And so we do notice that the Chinese community was trying to alert the government of Canada about issues that would arise as a result of this disease. We also had requests that were made by parents to have, you know, students that had traveled to China stay over, you know, be requested to stay home and not come to school. And Terri has already alluded to how, you know, that wasn't necessarily the smartest thing to do, because at the end of the day, we see that the numbers that were imported into Canada from China were very slim. But what we are learning is the fact that they were actions that were early actions that were taken that the community felt would be good for the overall health of Canada. This is really interesting, but another thing that we see is businesses being really proactive. And we have the one case where the China Business Improvement Area, the BIA, purchased hundreds of wall hand sanitizers and distributed to local restaurants. And then in early January, you start seeing signs on restaurant doors in Chinatown, which included what we see here. So it says here, we disinfect the kitchen and dining area every 4 hours. All employees wear masks. We provide hand sanitizers to all customers, and that employees check their temperatures before they take up their posts, and then 3 times during their shift. So as you can see, a lot of these measures that you know, Chinatown is, the restaurant is referring to, are things that we now know are commonplace in terms of our public health initiatives at this present time. This is another picture that was taken February 17th, and basically saying that due to the current matters referring to COVID-19, we're going to change our hours from 5 to 11, and this was before Ontario's state of emergency was declared. And so, you know, in response to this, I mentioned this already, so there was stigma and microaggressions to those wearing masks. School boards actually banned children from wearing masks at school. We know that many of these petitions did not really influence our public health actions, and it was only till later that I think, you know, didn't directly influence the actions as early as the petitioners would have liked. And, you know, another issue is that a lot of the business was considered to be solely a form of discrimination towards Chinese business owners. But what you can also notice is that these are responsible public health actions that the community took, and that was all dismissed. And so while we're talking today about, you know, stigma, we have to think about where things are going to go tomorrow. And a lot of our participants are really worried about the backlash that the Chinese community will likely face once these physical distancing measures are lifted and things go back to a new normal. Just a couple of weeks ago, we have a Conservative MP for Belleville, Ontario, making really controversial comments against Canada's Chief Public Health Officer, Dr. Theresa Tam, basically implying that she's a pawn for the Chinese government and does not have Canada's best interests at heart. There are also, you know, on April 29th, maybe some of you received it. I have mine, I received it. Basically, a newspaper delivered to hundreds of homes across the GTA referring to COVID-19 as a biological weapon and arguing that it should be called the CCP virus in reference to the Chinese Communist Party. And this was proposed by a movement, a religious movement in China that has been declared illegal. But you see that this is all kind of fueling this potential backlash when things open up. And so in conclusion, you know, in this short presentation, it's a very complex issue. What we do want to note is that the Chinese community is definitely not homogeneous. We note that the Chinese Canadians adopted protective and risk awareness actions long before official physical distancing was implemented, and that there's really something that emergency managers and public health authorities need to do better in terms of really engaging and listening to communities. Given all that we've mentioned with respect to the stigma and discrimination faced by the Chinese community, we really need to make sure that efforts are taken to destigmatize the community. One way to do that is learning from them, which is what we're trying to do through our research. So with that, thank you so much for your time. We can open up, I guess, the floor for questions.
Thank you so much, Dr. Mamuji, Ms. Chu, Dr. Rozdilsky. That was really hard to hear and really important to hear. So thank you very much for bringing it to us today. So we have about 15 minutes for Q&A. So I'll invite members of the audience, please submit your questions through the Q&A button below. And I'm going to take advantage of being the moderator today. And I'd like to start with a question of my own, which is primarily for Terri, but all of you, you know, feel free to jump in. How can allies help reduce stigma towards the Chinese community in the GTA?
Thank you. That's actually a very good question. And everybody thinks about this in terms of a short-term thing, what you can do now. Obviously, on the short term, if you do see somebody on the receiving end of racist remarks, stigma, you can be a good ally. All you have to do sometimes is just stand beside them, talk to them, just diffuse that situation. But on the bigger picture and the longer term thing, anybody out there who's listening to this and you have a platform, or if you're a media producer, if you are, you know, if you have a newspaper, any kind of platform, remember that we exist not just as our racialized caricatures. Help give racialized people, and not just the members of the Chinese community, all racial minorities, give them platforms at times when you're not just talking about racialized issues. We are doctors, we're lawyers, we're engineers, we're plumbers, we're technicians. We fill every segment of society. And whenever you see experts on TV, overwhelmingly, they fit the profile of being white, usually male. So if you really want to help minorities and women, treat them as people, get their expertise, get their opinions in front of a camera, on paper, and have people see them as the experts and as the knowledgeable people that they are, as the segments of society that they fill, see them as members of society. And that will go a long ways towards reducing stigma overall. Because right now, I mean, we saw a lot more Asians on TV since the start of coronavirus because this was an Asian issue. We didn't see them before, but they were still there. They were still filling whatever roles that they were doing. We just didn't see them. So allies that really want to help, if you have a platform, try to put in a minority of whichever persuasion, because we all need your help. Because the next disease outbreak, it could come from Africa, it could come from the Mideast, it could come from anywhere. And it's going to be that community's turn to face the same level of stigma. So that is what I would ask of our allies. If you have a platform, please use it.
Thank you very much. That was great to hear. Over to Dr. Rozdilsky, excuse me. I have a question for you. You mentioned that the research project is also looking at Nairobi, Kenya. So why did you pick Kenya, and how is research progressing there?
Yes, one of the factors we are seeing with globalization is that the Chinese central government for the past few years has been engaging in some pretty intense forms of economic development on the African continent, providing development aid for the building of ports, railroads, airports, and expressways around many countries in Africa. So what we have observed is that there are many persons of Chinese origins right now living and working in Africa in relationship to infrastructure development. A slightly different type of immigration than the types of immigrations and diaspora we see here in Toronto. Nonetheless, we are finding that issues are existing on the African continent in the same way with some of the social factors and how Chinese communities are being impacted both health-wise and socially by COVID-19. So we have a team on the ground right now working in Africa who has started a parallel process doing interviews and fact-finding in the community, much in the same way we are doing here in the Greater Toronto area.
Great, thank you. So I have a question from Anita Tasheva. One of the reasons why the WHO was slow in proposing travel restrictions was reportedly due to concerns around stigma. So what is the right balance between making health decisions based on where outbreaks occur and yet ensuring they don't stigmatize certain groups? This is a good one.
Yeah, no, thank you so much for the question, Anita. And I think one of the things that we as a group are really trying to do through our research is highlight the fact that we need to be proactive. So if we're waiting until the next pandemic before we start to address issues of stigma, we're going to have the next, wherever the next pandemic originates from, that community is going to face the same stigma, and public health decisions are going to be affected by the potential of that, the fallout that might result. And so what we're trying to do is basically better educate communities in general to say, none of these actions are helpful, and when these and in fact, stigma actually exacerbates the spread of disease because, you have things like the WHO being reluctant to set travel restrictions. So what we are trying to do is take what we're learning, at least in the Canadian and at least in the Toronto context and in the Nairobi context, take what we're learning and then engage with public health officials, engage with emergency managers, and work on developing some kind of campaign or some kind of initiative where we're really trying to promote community cohesion. And so at least if we're trying at a local level to kind of address these issues, to address targeting of specific ethnic groups, hopefully the next time that there's a pandemic, people will be wiser and our officials can make the decision that they think would be best without having to worry about the social impacts.
Thank you, Dr. Mamuji. Did anyone else want to take that question, or I can move on? Okay, great. We have a next question from Yvonne Nguyen, who says, thank you very much for this presentation. My question is whether the discrimination against Chinese communities becomes even more severe after the pandemic. Will we be more hostile towards each other? I've started to notice there's a subtle emotion of, quote, I told you so in my community, and I don't know how to ease the tension.
Thank you for raising this, and that's definitely something that we are aware of. There's definitely a lot of talk about the potential backlash the Chinese community is going to face. And just as we're conducting these interviews right now, closer to the start of the pandemic, at least March and April earlier on, we will be conducting similar interviews with members of the Chinese community, a year and a half down the line, when things open up, and see, what are the social impacts that you are now facing now that things are opened up, so that we can get a better understanding of what impacts they are facing when things go back to normal. There are also a lot of initiatives that we have come across that are initiated by actually members of Chinese diaspora communities in the GTA, where you have trackers or people that can go in and report any type of stigma or backlash that they're facing, and hopefully use that as a database to then implement actions to address that, highlight the level of impact that the community is facing. I don't know if Terri or Professor Rozdilsky want to add to.
Thank you, Dr. Mamuji. I have a point I would also like to add from the bigger picture perspective. When I look at COVID-19, I look at COVID-19 as a public health type of disaster. And we know disasters come in many forms, both natural and human-caused disasters. And disasters have their own life cycle. And I think that's what we are seeing in COVID-19. When a disaster first strikes, we have the shock of the disaster happening. We have the initial coping, and then people try to help out, understand what is happening, and try to cope and get through it. But then once the disaster is going on for a longer period of time, once we see this crisis is elongated, I think we eventually reach a point, and as we do at most disasters, where people start attempting to assign blame. Did somebody do something wrong? Is this someone's fault? Could we have done things better? And I think right now we are starting to see a shift in how the discussions in terms of society are taking place with COVID-19, where we are still in the coping phases, but people are also starting to begin to ask questions, which can be constructive or non-constructive questions, but usually in a crisis situation, it usually reaches the point where people rightly or wrongly try to ask who is potentially to blame for what is happening. And COVID-19 may turn out to be no different.
Thank you very much for that, Dr. Rozdilsky. Very good point. This is actually all the time we have for Q&A today, so I'm going to wrap up, but I'm actually going to end with a comment by an audience member, Lisa Zanette, and I couldn't have said it better, so I'm just going to use her words. This was an excellent, well-presented webinar. I'm so glad to have heard it. These speakers were honest and truthful and knowledgeable. I, as well as many others, I'm certain, are very happy and glad they presented the absolute truth that was very much needed. An eye-opener for sure. Hopefully we'll all be the wiser because of this.
Thank you.
Thank you.
Thank you. Thank you to all three of you. It was a pleasure to meet you, to hear from you. And I think it would be wonderful if you could come back post-pandemic and you know, refresh your findings for us. I think that would be really, really neat. It would be lovely to have you back.
I would love to. Thank you so much for the opportunity.
Thank you.
Sure. Thank you.